Here we have an EC135, and we'll do a quick walk around to look at some of the key differences between this aircraft and the EC145. Notably, the EC135 has lower vertical clearance near the clamshells. Additionally, you can see the tail fenestron near the tail rotor system. This is an enclosed rotor, so it's a little bit safer than the exposed rotor on the 145. We'll start at the clamshell doors. On the 135, there are 2 latches on the rear clamshell doors instead of 3. As you can see, the latch system operates a little bit differently. To open the latch, you pull on the metal hook that is protruding from the latch, but to close the latch, you have to make sure that you press on the latch itself, not the metal part sticking out. Inside the patient care compartment, there are a few differences as well. The radio bulkhead is moved adjacent to the patient care seat. To activate the oxygen, you have to press the oxygen button. There's no shutoff switch that the pilot controls. Some of the 135s are equipped with an onboard medical air compressor. If the 135 doesn't have one, you will have to utilize the portable air compressor, which we will review later in the video. Some of the 135s have a radio system set up that is similar to our main Skybear helicopter. A couple of them have setups closer to some of our backup aircraft, so just take some time when you first get into the aircraft to review the radios. If you get stuck or confused, you can always ask the pilot to take over radio communication for the flight. The seatbelts are another notable difference in the 135. The forward-facing seatbelts are a standard 5-point restraint system. The rear-facing seatbelts often have a more car-style seatbelt. Now we will take a look at the loading sequence for the NICU isolette in the 135, utilizing the NICU isolette carrier. This view shows what it looks like from the patient compartment. Once the isolette is fully loaded, there is very little clearance between the airway seat and the isolette, so watch your knees. Collapsing the isolette carrier is quite simple. However, be mindful of the several safety latches that have to be turned in a horizontal position in order to allow the carrier to collapse. Watch your fingers as you're closing the carrier down, as it's easy to get a finger pinched in the accordion mechanism. You can see as Pete is closing the carrier, the locking latches have to be in an open, horizontal position for the carrier to continue to close. To lock them in place, turn them back up to a vertical position. You can stow the carrier and then your transport bag in the aircraft and secure them with the yellow straps as shown. When looking at the portable air compressor, there are printed instructions on the device itself. The device won't work until AC power is on in the helicopter, and then the air compressor can be turned on and adjusted. See the instructions listed here. To adjust the pressure, you have to pull the dial out, turn it to the appropriate set pressure, and then press it back in. Unloading the isolette carrier is similar to loading. Again, the locks have to be in a horizontal position to open. Extend the carrier until the vertical bars come down to the horizontal lines as marked on the metal pole. This will be at the correct height and length to unload the isolette. When you are unloading the isolette, the main lifter needs to extract the isolette from the aircraft. The person on the left should be extremely vigilant to watch the left side wheel and put hands on the isolette and verbally call stop to prevent it from rolling all the way out if need be. The isolette carrier is then brought in line with the isolette and the rear is placed on the carrier. The carrier is then lifted up to the isolette and the entire thing is lowered as a unit. Kneeling on one knee helps you maintain good body mechanics and avoid lifting with your back. Here, we'll see the unloading again from a different view. Proper lifting technique should be used to lift with your legs and not your back. In this case, proper lifting technique is not demonstrated. There is not as much space in the clamshell compartment of a 135, and the bags may have to be secured in a slightly different manner. You will not be able to fit the medication bag and the red pump bag in a vertical position on the stretcher as usual. Bags should be placed in a horizontal manner on the stretcher due to the height constraints. The stretcher on the 135 is a bit shorter and more lightweight, which makes it easier to tip. The loading process, however, is fairly similar. You can see this underhanded view grabbing the leg release lever in order to load the stretcher. Here, you can see the bags loaded and secured for flight. Make sure that both the backup bag and the vent bag are secured. When loading the 135 stretcher, there are two different sets of wheels that you have to get loaded into the aircraft. The first set is on the angled bar up by the head of the stretcher. The second set is toward the middle third of the stretcher. Another very important piece to remember is that the head of the stretcher must be laid flat during patient loading. The patient cannot be sitting up or they may be injured. Additionally, key equipment such as the monitor and ventilator must be passed through into the patient care compartment because there's not sufficient clearance between the side railing and the patient care seat when loading the patient. If the patient is not very tall, the blue primary bag can be kept on the foot of the stretcher and secured as seen. When you are performing a two-man load, you can load the head of the stretcher onto the back of the EC135 and then pass the monitor and ventilator through. It can be placed on the patient care seat, and you can then return to load the patient the rest of the way. It's helpful to have a safety officer to make sure that the loading goes safely and smoothly. There are several different ways that bags can be secured depending on how you load them. However, make sure that any equipment that you may need urgently is readily available as it is difficult to retrieve during flight. Here we see the equipment bag and the monitor secured in the parent seat. Additionally, if you ask the pilot, you can often secure an extra bag up in the front co-pilot seat. Make sure that the seatbelt buckles go through the handles of the bag so that it is absolutely secured during flight in case of a sudden movement. Unloading should again be done with caution as the monitor will have to be moved while you are unloading the patient. It's helpful to have a third person to move the monitor. Otherwise, pull the patient out part way, move the monitor, and return to the rear, making sure that both parties are in place for the final unload of the patient. While wheeling the patient around, the monitor can go on the side rail of the stretcher. Thank you for taking time to refresh yourself on EC135 operations. Have a safe flight.